So tonight we're going to be talking about the improving population health with wearables. There's obviously a lot that's been going on. Those of you that heard Tim Cook this week talk about how big a part of Apple just their smartwatches are, and their wearables are. And he obviously they don't want to give out any numbers, but they said that just that part of the business would be large enough to be part of the Fortune 300 just by itself, just for Apple. So there's a lot that's going on there. There are other companies, whether it's Michael Kors or Armani, who are building these smartwatches. There's a lot that's going on in the area. We're all watching the Olympics. There's a lot going on with how they get trained, and it's not just the Fitbit, but it's also the clothing and what they wear, and constantly tracking how they are continuing to do their jumps and the stresses that they're putting on their bodies and the best way to train. So that all that is being brought together for not only professional athletes, but also for consumers. And so to talk about that, and I wanted to give you a quick background on how big this industry is and how it's growing. We've got some great experts to do that tonight, and I want to bring up Julie Price, who is our moderator for tonight. She's head of the customer development at Mach 49. And Julie, if you'll get your on there.
Okay, thank you.
Set to go. Thank you.
Okay. Thank you. So I work with a Silicon Valley incubator called Mach 49, and we work with Global 1,000 companies who want to spin out new businesses. Just quick background on myself, my team. We are responsible for the customer-centric process so that we, in the course of 3 months, can help these big businesses come up with a product idea, starting with the brainstorming, iterate it, and end up with a product that we trust that the features and the design is one that you can actually build a business around and spin out as a separate entity. But I am very happy that I've gotten to work in the wearable space as well. And personally, I have been an early adopter in wearables, and every member of my family has one, including the baby and the dog. So I'm very proud to be here among the esteemed panelists, and I look forward to hearing from their different perspectives, coming from the insurance side, the wearable data side, and public policy side, hear their opinions on the industry and where it's going. So I'd like to call up the panel to join us. And give everyone a chance to start out and introduce yourselves. Theo, when you're comfortable, if you want to jump in.
Hello? Okay, great. Hi, everyone. My name is Theodore Harvey, and thank you for allowing me to come speak to your great group. I'm the co-founder and CEO of SynsorMed. We are a data analytics software platform that integrates with just about any wearable device for the healthcare space. Currently, we're focused in on hospital readmissions, and so we've been in the business for about 4 years now, and we're really seeing a lot of uptake in what we're doing. The key areas are really preventing these hospital readmissions because, quite frankly, a lot of hospitals are getting penalized, so it affects their payment. So by us helping them with that, they're seeing the need for that data at the patient home. And so us providing that data for them and helping them with that is really driving up our audience, hospitals' acceptance in the wearable space. We started out as looking at also wearables, not just wearable devices, but also sensors. So for instance, integration with devices like oxygen concentrators or other different devices like that to kind of provide the whole healthcare experience, if you will, for the patient at home. So that's definitely our vision, to really enhance the patient experience at home, and we look forward to talking to you more about that. Thank you.
Hi, I'm Kim Isett. I'm a professor at Georgia Tech in the School of Public Policy. I work in the space of public health and how we can use evidence-based approaches to healthcare and get individuals and communities the care that they need, the kind of care that they need in the way that they need it. And in particular, for this panel, I'm interested in the fact that 80% of disease in the United States is caused by behavioral choices. And so, but only 2% of public budgets are focused on the diseases that 80% of the population suffers from. So wearables have a great potential if we know how to motivate and structure public spaces and public policies to influence behavior change, so that we might see the curve shift a little bit and diseases like hypertension and obesity start to be on the decline.
Okay. Hi, good evening. I am Phani Konduru. I am with Humana. And for those of you who are not familiar with Humana, Humana is a company, a healthcare company, providing insurance, health, and wellness services for members across the United States. We serve about 14 million members. While we do serve employer groups, small and large, as well as military, our primary focus is really serving seniors, especially those with chronic conditions. And our primary goal is really to help our members, especially those with chronic conditions, through an integrated care delivery model, where we're really looking to simplify and deliver an experience for members so that they can manage their health in a more effective manner. And today, along with the panel, I'll just share some points of view about our experiences and how we are working with partners and leveraging some of the wearables as well as some of this technology to really help members as well as employers really get some better health outcomes and deliver some better results for themselves as they work with us.
Okay. Thank you. So, Phani, why don't we start with you, actually? That's a nice segue into the first question, which is, do you want to talk about some of that work that you're doing in the wearable space that aims to impact public health?
Sure. I think I'll start with specifically in the employer group. Over the last 8 to 9 years, we've been working on this program with a platform that we created for wellness and rewards. Previously, it was called Humana Vitality, but now it's called Go365. Over the years, what we've done is working with different wearable partners, engaged with the employer groups, and really partnered with them to really focus on what's the outcomes that they really care about for their employees. One, I think they want to make sure that their employees' health is managed effectively. Two, from a business perspective, they're looking at managing their healthcare costs, which are continuing to spiral not only for them as well as for their employees. And then three, from a productivity perspective, they're basically seeing, is there something we can do to help improve the productivity for our employee work base? So we've got some experiences with those programs. In fact, we had a 3-year study done across some of these employer groups, and what we saw was a difference in engaged members who really, when they're engaged, we see a significant decrease in medical costs for the employer, almost 10% reduction for engaged members compared to disengaged members. We also saw about 25% increase in decrease in absenteeism for those employees, which really results in the productivity increase for the employees, for the employer. And then we also saw a couple of other things from a clinical perspective. One, we saw that reduction in emergency room admits, as well as we saw from a chronic condition perspective, some of the lifestyle changes that results in the chronic conditions. We saw really those lifestyle conditions continue to improve for those employees. So it's a series of experiments that we have to continue doing by partnering with the employers itself, where we really localize the engagement with the employer, design rewards for the employees that the employer really sees for their employees, for the employer really sees for the employees. And over a period of time, we continuously improve those rewards for the employees. And we've extended that into including healthy foods, as well as some of the behavioral aspects where we can provide employee assistance through some behavioral health coaches for certain conditions that certain employees may have for their employees itself. So this is a program that we're really seeing from an insurance perspective, helping the employers manage the population that they have within their employee base.
Great. thank you. And Kim, would you like to answer the same question? So what current work are you doing in the wearable space that aims to impact public health or?
Sure. So what I'm concerned about is that individuals when we think about public spaces and public policy, so figuratively public spaces, but also physically public spaces. So the spaces that we live in, the spaces that we work in, the spaces that we use to get from where we live to where we work. They are not, in the United States, they are not constructed so that we can make good choices about our health or even good choices about our lifestyle. And so how can you eat an apple if you don't have an apple available? So things that can motivate us, like nudges, reminders that wearables can give us, make it possible to make decisions in the very moment about sitting for 15 more minutes or getting up and moving around so our metabolism shifts. Or how we make better food choices in the spaces where we're making choices about what we eat and what we put in our bodies, or even reminders about exercise. And so if we can use public policy to do things like make sure that that you have a walkable space in your neighborhood so that you don't have to get in your car to go a half a mile down the street to buy some groceries, for example, or get your kid to school. You can walk because there's a safe place for you and your child to walk, that you're not afraid of getting hit by a car, for example. And wearables can facilitate those tiny choices that we can make, and public policy spaces and decisions and funding about funding with infrastructure and policies about how we're going to use our public dollars can facilitate all of those things and work in conjunction. I don't believe that technology and wearables are the answer, but they have to come in a suite of things that can all work together to facilitate better choices at the individual level, and then change over accumulation in individual data points accumulate into population health changes. We've seen this done very well in New York City when Mayor Bloomberg put major investments in New York City with things like bicycle lanes and walking paths and planting more trees, and all of those things increase the rate of walking and bicycling in the city. And so pairing those kinds of public policies with wearables that remind you that these options are available can then improve public health. And those are the kinds of things that I work on and the things that I'm interested in.
Great, thank you. And Theo, your current work in the wearable space that impacts public health, that aims to impact public health.
Yeah, I mean, where we look at it is public policy drives reimbursement, and the doctors we talk to, they care about how they're going to get paid, right? And so there's a big shift in healthcare right now from what they call fee-for-service, you do something, they get paid, to what they call value-based care, where they're looking at the whole continuum of the patient, right? From when they enter the hospital, when you see them, to they're at home. And so there are some new mechanisms coming down the pipeline, not to get too deep in the weeds, but macro MIPS is one of them that allows, now they're looking at patient-generated health data. So basically, Fitbit and Wearables, they can get incentivized, right, for providing that to their patients and getting that data, and they get a check mark, right, to show they met some of these requirements for what they call quality measurements. So that's one way. Another area they're looking at is what they call chronic care management. So, managing patients remotely, right, with some of these wearable devices, they can now get upwards, there's a CPT code now that allows them to get up to about $60 per patient per month for monitoring that patient. So, it's starting slow, utilization is low right now, but I think that's really going to make the change when you talk about public policy, right? And so when we tell the doctors about it, they're excited because they're like, hey, I want to do this stuff because I care for my patients, but I don't have cycles, I don't have time. But if they start shifting the financial incentives that way, then they'll make the time then, right? So that's what we're starting to see now with some of the wearable solutions that we're working with some of our clients with right now, currently.
Okay. So do you have any success stories that you can share that will lead us to believe that wearables can improve the overall health in our communities? We can start with you, Theo.
Sure. Yeah, I was just looking up something we did. We worked with a kind of a rural area in Dalton, Georgia. How many are familiar with Dalton, Georgia is? It's like if you're almost in Chattanooga, but not quite, right? So we worked with a client there, and they're like one of the largest pediatric practices there. They got 20,000 kids, and they were really focused on childhood obesity. And so we put a program together where we were kind of monitoring the kids with Fitbits, make sure they're doing activity levels, tracking their food, doing all the things, that we all know to kind of stay healthy. And we also put what we call gamification around it, right? So incentives, reward-based systems to encourage them to stay active and do all that. And we saw great results of the 15 kids in the trial. About 10 of them, they all reduced their weight about like 20%. Because they did it over 3 months. And so what we found is, like was mentioned before, just a little nudge every day. So notification, say, hey, did you walk today? What we also found too is having the loved ones, the caregivers also receive that nudge. So the mom is like, wait a minute, Johnny did not walk today. So they're talking to Johnny and say, Johnny, go ahead and walk. Well, Mom, how'd you know? Because I know what's going on. So it's almost Big Brother-ish, but also it helps, right? Improve their behavioral change over time, right? And then what we found is the kids, they got more active and they were able to, kind of keep these habits. We'd love to go back in about a year and to see if they kept it up, right? That's really going to be the big thing, right, to understand that. But like in that 3-month period, we saw some great results, and we want to continue with those trials going forward.
Great. Okay, we'll just jump over to Phani.
Yeah. I think I mentioned about the successes that we've seen in the employer groups, but I just agree. I do agree with, I think, the other two speakers as well around, it's a combination of factors that you really have to apply. You talked about the public policy with the reimbursement. I think that really is a big motivation for driving the change. So the platform that we see and with a complete comprehensive look at from a health perspective, which is really not just about the physical health, but also I think the socioeconomic conditions that the individuals live in the community that they live, that makes a big difference as well. The behavioral health access that people have in that particular community. So slowly, I think what we're seeing is if you really focus on a particular community and understand and partner with public as well as private companies in that space, including NGOs, we start seeing certain changes in the public health or population health of that particular community. At Humana, we have a program called Bold Goal, where we, over the last few years, we've really engaged different communities. We started first in San Antonio, and we started understanding basically what is driving the health of that particular community. And we had enough data about our members. We had about 500,000 members in that community. And we started looking at what's really the main prevailing diseases in that area. And diabetes was one of those. And part of using the platform that we have with Humana Vitality, as well as partnering with the different local public and private institutions, we were able to really identify and hone in that it is not necessarily just the physical health issues that are leading to the prevalence of diabetes, but also access to healthy foods. About also behavioral problems that community particularly has. And all of those things, I think, start helping you identify that while wearables can solve one part of the problem, you can really start looking at, you have to start addressing the other parts of the program as well. So I think we've seen some success with this Bold Goal program in certain communities. Our goal from a Humana perspective was to really improve the health of the community. And we had set a goal for us that every community that we serve will improve their health by 20%. So, happy to report that we're making good progress on that goal. In fact, within the Humana associate community, using some of their wearables and a comprehensive program, we've already achieved that goal. And we really measure that health of that community by a CDC measure called Healthy Days. So it's not our understanding and our metric, it is really what the members themselves say or the people themselves say as to how healthy they are feeling. So that's what, from a success perspective, we're starting to see pockets of success over here, but we are really early in our journey. And I do feel, I think, from our perspective, wearables will play a big part in that success. but it will require multi-dimensional approach.
Great, thank you. And Kim?
Well, I think that there's a lot of demonstrations out there that work. So at Georgia Tech, there have been some demonstration projects where they've gone up into Rome, Georgia, and worked with women who are pregnant and are at risk for postpartum depression. And so they've created some technology that has shown good results there. A former colleague of mine at Columbia University has looked at some of these sensor devices and has used them in under-resourced communities to look at how many days or how many steps individuals are walking, and at a time when there were some physical infrastructure changes going in, and then could also measure through these devices not only the increase in walking once, say, street lights went in a normally dark neighborhood, but also who they were passing and how long they were spending talking with people. So also this, not only just physical health, but this social well-being idea where they were now outside and making connections with people and standing outside and talking. And we know that there's a robust relationship between social connectivity and overall physical well-being. And so I think that there are a lot of things out there in the literature and also in the test space that have shown great promise.
Thank you. So clearly there's a lot of success, there's a lot of reason to be optimistic. On the flip side, just want to introduce another thought. What can we learn from the high rate of abandonment in wearables? And along those lines, what should we be learning from behavior change research and habit-forming technology models? Do you want to start, Kim?
Sure. So I think the thing with the abandonment, and I'm not an expert on this, but I think, just like after the first of the year, people join gyms, and then they abandon gyms. It's the same kind of thing. How do you sustain the enthusiasm, and how do you sustain the momentum of people being, really using this to make long-term sustainable changes? And I think that some of the programming may have been off base with some of the earlier wearables, and thinking through things of how the reward system in our brains are tapped through these mechanisms, and whether it's tapping in, whether it's a simplistic model of reward or human reward, or whether it's more complex and more nuanced. So I think that we still have a lot to learn about what creates sustainable change and what creates enthusiasm for individuals to be motivated for real change in their lives, rather than short-term change where they don't get the quick hit, and that's not built into these early and some simplistic modeling of the wearables.
Great answer. Okay, Theo?
Yeah, so I would agree. I think there is some abandonment issues there when it comes to these devices. What we've seen that does work, what does tend to work, like I mentioned before, if you have a comprehensive system in place where you do have caregivers, loved ones who are interfacing, so they're also aligned with if the patient is using a wearable effectively enough, so that helps. The second thing is also we work with hospital readmissions, so there's a 30-day period. They really want to prevent them from coming back into the hospital. So really having a tight timeline and making sure they're monitored after that. Now, statistically, it says, if they make that 30-day, the likelihood to be reimbursed goes down by 30-40%. So that helps, but I think what's going to kind of help with that, and what we're starting to see, is really kind of having, that other individual, kind of working with them, right, with that, right? So why are you not using it? What's going on? maybe even peer groups, especially older seniors. Some of the issues, unfortunately, is just social interaction, right? They lack that. And so, loneliness can have, there's a lot of other mental conditions that prevent them from wanting to stay healthy, right? You just lose motivation. So if you are in a great peer group that's motivating you and encouraging you, that tends to help, right, from what the studies have shown. So I think, really kind of thinking through a more comprehensive program and understanding, like we've talked about before, wearables by themselves don't just solve everything, but, it can be a key component of what you need to really be successful in making sure, you're changing behavior for the rest of the person's life. I mean, how many of us struggle with other things that we're trying to do, right? Creating habits is tough, right? And so in healthcare, you're trying to change their habits for the better, and it's tough for them too. So, once you kind of understand that, I think the goal is to kind of making sure you create the mechanism in place so they are successful, whether that's with peer groups, help from the hospital, or for loved ones.
And Phani?
Yeah, I think our observation really is, I think, twofold. I talked about the general population, which is what I would like to call it, maybe under 65, and not the seniors. I think in that space, it truly is about, keeping it, how do you keep them engaged, right? And that requires a whole bunch of, engagement designs all the time and continuously refining them. Our platform, I talked about the Go 365 platform. We've tried various things like gamification things. We've tried things like challenges where we create, the platform allows employees or even family members to really create a challenge, like a 100-day dash that we do at Humana, or every 15 days we basically say, okay, if you create a challenge between a people of 5 group, you get rewarded with some extra bucks. We call it Go 365 bucks. And as they accumulate more bucks, they basically can do things like, depending on the employer, I think we let them cash out in Amazon gift cards, or they can buy more devices. They can even buy things for their own family. So that, and then we have another program called Healthy Foods, right, where we have engaged, partnered with Walmart, and if employees go and purchase some things in Walmart, using the program, they get a certain percentage discount. And over a period of time, we monitor basically saying who's using, who's not. And then that results in better incentives or reduced incentives. So that's what we're seeing in that population in terms of, how do you create stickiness, right? Otherwise, you'll find abandonment of these wearables and these programs itself. When you go to the senior population, when you go into 65, the core health issues that are driving are mostly what we call chronic conditions. And most of the seniors have multiple chronic conditions. And there, the stickiness for wearables is the potential is really, really high. But it is ease of use. That's where I think we have to, there has to be much more evolution of the wearables to say, let's identify specific conditions. For example, one of the things that we're doing right now is a congestive heart failure. While it's not a wearable, but one of the devices that we're using is, we understood the member's condition, and research tells us that when members who have congestive heart failure, they see a weight increase day over day, there is potential for fluid buildup, and there's likely a situation where they might end up having to go to an emergency room. And no one, neither the member, nor the insurance company or the provider wants someone to end up in the emergency room. So one of the programs that we have put in place right now, and we are still going through this program. Over the last year, we provided scales to the members where and then every day morning as part of their daily routine, they can step on the scale. The data automatically sends us back over the cloud to us. And then we have analytics behind the scene which analyzes their weight and then saying, did we detect a signal where this member will likely need any intervention? And if they need intervention, then we partner with their primary care doctor and make sure that their primary care doctor can intervene with that member. And in some cases, we have surrounded the primary care doctor with even services, at-home services, where we can send an at-home service to the member's house and deliver that intervention so that they don't end up in the emergency room or hospital. So there are things like this that, I do feel pretty, positive that as we continue to see evolution of the wearables, especially in that population, to figure out how do you make an experience integrated into their lifestyle, then we'll see a lot more adoption of wearables in that particular space.
And if I just may add something, I think, the greatest wearable is actually this device right here, right? So, there's also activity trackers on here. So we're actually, customizing our software to kind of just, what can you do very simply on these devices here that allow the patient, because even in the older population, the adoption rate for smart technologies is increasing. So, we're looking at really, obviously, because the problem, unfortunately, with the Fitbits and other things is the cost factor, right? And so there's always some pushback of who's paying for that, because, I'm in business and always people are always asking for that. So we're looking at, form factors that make it a lot easier to kind of utilize, these devices to provide that. And there's some innovative things coming down the pipeline from Apple and Samsung around monitoring.
And the key to the smartphone is that is what I will call the myth of the digital divide, that smartphone adoption in poor communities is exceptionally high because that is the only thing that they can afford. So they can't afford a computer. This gets them connected. And so having it integrated into the smartphone, I think is, you reach a bigger part of the population than you can with any wearable.
Interesting. Sorry, I'm struggling to figure out how to ask my question now about wearables and phones, so don't mind my pause. Just trying to problem solve on the fly. Okay, so you've been talking about what I've heard was the stickiness and the engagement hooks and making sure other people are involved. You're getting them the information they need, whether it's from a provider or from family members, and then also rewards and opportunities and making sure these are baked into the system. So given all of that, our hopes for what our future products and wearables and phones do, what other opportunities do you think we should be leveraging from the prevalence of these devices to impact our population's health?
You talking about like now or 10 years from now or just in general?
Your choice. Whichever one you'd like to answer.
Well, I think, augmented reality is something I'm excited about. I think something as simple as, eating is about 80% of it, right? And healthy eating and be able to kind of look at the nutritional content by just having glasses that can read that content for you, I think would be huge, right? I mean, that could save a lot of the disease states that we have now, right? And so, augmented reality, I think, and, it could be a wearable, obviously, with glasses. And I know Google Glasses tried to do something along those lines, but I think it'll come back, right? And, just like everything. And I think that's probably a good, 5 to 10 years off. But I definitely feel that could be huge, right? That can really shape the healthcare space and help folks not only, watch what they eat, but navigate where they need to go, be healthier, individuals they can reach out to, because now it's a part of their living experience, right? It's embedded in what they do day to day. So that's 5 to 10 years out. Now, maybe, a couple of years from now, actually more fashionable wearables, right? Something that's really embedded in your clothing that you wear. The gentleman talked about, blue chips. I know a lot of the athletic wear, is wearable and, makes it easy for them to use so they can track, how high they jump. So I think, embedding that into, if you buy something at Macy's, right, that could really kind of track some of the things. I think that's where it can go. And we know that some of the, more higher end retailers are looking at that, right, embedding smart technology into their clothing right now. So I think those are like the two areas, basically about fashionable and then also looking at augmented reality is where it is now, where it could go in the next couple of years.
Okay. Great. So taking your interpretation of the question, that was the right, interesting way to answer it. So we'll go with that. So what would you say is your prediction for the future, the most provocative shift you'll see in wearables in the next 10 years? Kim, we'll jump to you.
Well, I think once we figure out how to leverage the data and how that data gets connected to all of the other internet of things that we have in society now. But I think that there are thorny questions with that, such as the ethics of who gets to use that, who owns that data, how and where it can be integrated to make both individual level changes, does your employer get to see that information? And I think that there are some powerful opportunities for government health agencies like local departments of public health and if to get wraparound data from other sensors in public spaces that are possible, that could really shift the way that we think about how we do health and health care in the United States. But I think that those questions are going to be knockdown, drag-out fights. But if we can answer them, and if we have good rules and boundaries around them, we can really shift the curve. And I think that it's coming, but we have to have those debates, and we really don't know what to do with this data yet. We're really neophytes with this. So.
Well, just to go out on the limbo here, I see a future where, just before this event, when Phani was walking in to have Chick-fil-A, some of the variable on me will basically say, stop. You've got a condition that is not good for you, so you need to stop eating that. But I think the promise is there. I agree, I think, with what Kim is saying. I think there's the back-end infrastructure and the data analytics as well as the AI piece is just advancing at such rapid pace that I think we'll get better understanding of what kind of signals do we need to capture. And that's what will help the wearable industry really start doing a custom wearable devices and fabrics, if you would, right? Those kinds of things will really help understand and deliver the right signal. And then using that back-end AI infrastructure, I think deliver back the intervention, right, at the appropriate time for each individual to really make sure that their health outcomes are optimized. That's, if I were to go out in the future, that's how I think about it.
Great. Okay. So we'd like to open it up to any questions that you would like to ask. So thoughts on providers like Humana subsidizing features like what you were discussing?
Yeah, I think that's actually taking place right now. Theo talked about value-based reimbursement, right? You see a lot of shift taking place from what we call fee-for-service, where today any episode is there, that's when you get paid for every treatment, and every service provider, right, has to get paid for that particular service, where the focus is shifting a lot more onto outcomes. Today in our business, especially on the senior business, about 60 to 70% of our members are really in value-based reimbursement models, where we are taking the risk along with the healthcare providers, whether it's the doctors or the hospital system itself in that local community. We're putting in money, right, along with taking on the risk together, because we feel that if we work together, and as Kim mentioned over here, when you integrate all the system and the data comes together, you start seeing that you can really coordinate care and keep the member in the center, deliver an experience which is focused on their health outcomes, and automatically the investment that an insurance company or an employer themselves who are willing to take the risk is making that investment, they see huge returns on that. So it's the whole reimbursement model for everybody in the value chain is really starting to get lined up to really focus on delivering health outcomes for the individual consumer. So that movement has already started, so that has resulted in a lot of experimentation being done, but every partner in the whole ecosystem really has to put in some investment and take on that risk to really realize the reward. So that movement is happening. You'll see more and more of that investment taking place by multiple stakeholders.
Yeah. And I would just say this also, what they call accountable care organizations who are getting, incentivized, to lower costs. So, I would like to see that too, right? Maybe they can pass that on to the patients or to purchase these devices, right? Or do that so that, because they know that ultimately helps their business. I don't think we're there yet, but, they are getting nice, extra money for doing some of these, value-based incentive programs. So I would love to kind of see that pushed back to the patients and obviously the insurers once they see the data and see the value, which they are, can start, really incentivizing, lowering your premiums down or, what you pay. So can you get on that? Tell the people how to get it done.
It really is. Data is the key. We're starting to get a lot more insight into what's driving the cost. And the other dynamic that we're also starting to see today is the product design of the insurance product also will start changing. Today, the product design is not driven from the consumer end. You'll start seeing that as the industry itself starts focusing on the consumer, right? The consumer itself, the needs will drive the product design of what the insurance products are.
Awesome.
Okay, great. Yes? Yeah. So is it worth it to give addictive technology that people like, such like a nudge, a device like an Apple Watch, rather than just giving them an incentive after the fact?
Yeah, I'll take a shot at that. I think what you're seeing is, you might have heard Aetna basically make an announcement saying that they are looking to give employees basically the Apple Watch at a subsidized rate in partnership with Apple itself. So you're starting to see movement in that manner. Part of the picture that you have to think about is when you think about a population, if it's an employer-based population, you really have to have a partnership with the employer to really think about what are the outcomes that the employer is looking to get, what are the outcomes that they want for their employees, and where you find organizations that are focused on the employees with a mindset of saying, if I have great employees in great health, I'm getting better business results. They're willing to make that investment in the employees, and there's a lot of benefit design that they can adjust and start saying that, is that really making a difference? And it's just not about giving device, then you have to design the programs where you incent the right behavior and take away, I think, where the right behavior is not being observed, right? So this is all about a behavioral science that you start seeing. I think it's becoming much more part of the product design, and a lot of the, especially insurance programs, are experimenting with that right now. Right? On the flip side, when you get into the senior population, we also have to work with the public policy. There is right now some regulations that really prevent a provider or an insurance provider to say to what extent can you really give certain cash incentive or certain money equivalent device to a member itself. So there is work that is being done in partnership with the public organizations and the government to do some demonstration projects to see will it make a difference. And that's where when you think about, especially on the senior side, there's a lot of analysis right now saying what is driving the cost, healthcare costs going up. It really is chronic conditions, right? Especially complex chronic conditions. The old 80-20 rule comes into play. So you really have to start catering into exactly those conditions and what is best for those members, and then start designing programs. It may end up being, there may be some wearables that may really make a difference for that particular program itself.
Any other thoughts?
Yeah, I just to say it's going to probably be here sooner than you think, because Amazon just got into the picture. They just made an announcement with J.P. Morgan and Warren Buffett, and so once they're in the mix, they're starting to think of new ways, and like you mentioned, new products, to deliver. So more to come on that, but it might be here sooner than we think, right, to provide that.
So the question is, the simplest device for seniors that will start to make an impact for them.
I kind of mentioned it, smartphone technology, but even the lower end smartphone technologies can do simple things like notifications, remind them to take their medication on time, and that's a big thing, right? Sometimes they were confused about what time they need to take medications, and that's something you can program now for them, right, to set up. But then also having that feedback into you or some other loved one to make sure that the parent, your parent is staying compliant. I think that helps, and that someone is monitoring them. I have older parents too, and sometimes they say, well, stop monitoring me. I know what to do, right? But you didn't take your medicine, right? So so you have to constantly remind them. But I think they appreciate long term because that's what we've seen, at least with low level simple things right now beyond just wearables.
Any other thoughts?
Yeah, I think I mentioned earlier, our experience so far, we're doing a pilot with the congestive heart failure patients, right? The weight scales is one of those devices that we're seeing. We're starting to see results right now in terms of the adherence. How many of those, I think about 70% of the people we see, I think they really regularly use those devices, and we get the data for them itself. Then I think the other things that we're seeing is from a remote monitoring perspective, it really is, I think we have to figure out what are the things that are easier for them. complex things like even, phones and mobile phones, especially the seniors. It's newer technology that the boomers who are getting into the senior population right now, they are a little digitally savvy. But I think the seniors, I think when you start going about 70 and things like that, you start seeing, I think you got to make it easier, right? We have a device, I'm sure everybody heard about the purse device, I think, which is really, that's, it seems to be pretty effective right now. But that is limited in its application in terms of what it can do for the different conditions that we have. So there's a lot of experimentation going on right now with the various technology companies. Nothing that we have yet come across that at scale that we can share. But we are in that experimentation stage right now. But it's really, that's a focus right now. And I think with the evolution of the technology, we feel pretty good that I think we should be starting to see some progress in that area.
Question. So we are public policy laggards. Who is a good example of who we might be following, who we should be following?
By we, you meant the U.S.? U.S., not Georgia. Okay. It's a different scale. Maybe a provocative answer to that is Cuba. Cuba is quite amazing in what they do with their healthcare system. And part of that is because they are such a poor country. And they have universal healthcare, and they're a communist country, right? So if you are a Cuban, or if you're on Cuban soil, and you become ill, and their doctors can't cure you, they fly you and your family to another country for treatment until you're well. That's very expensive. So they do everything they can to treat you well. So they have great systems in place. They have great mechanisms in place. In Cuba, it's hard to go 2 blocks without seeing a hospital or a pharmacy. So it's widely available, and it's part of everybody's normal day. So that's one kind of one answer that was maybe unexpected. Another answer are the Scandinavian countries as a cluster, right? They're so damn happy. And I think that has a lot to do with it, but there are a lot of progressive policies that we're seeing there. I mean, there are the obvious ones like France and Italy, who are considered the best healthcare countries in the world, but they're also more socialist. But if you get to the Norwegian countries, it's it has a lot to do with in the United States, we're one of the only countries that believe healthcare is a commodity. And it's the commodification of healthcare and how we do it. And so shifting public policy focus, even just 5 or 10% at the margin, to shift away from commodification to maybe some more communal values or universalistic models can help us to move. And that's going to take a lot in this country. But I think the conversation has started.
Okay, thank you. Yes, so the advancement of wearables in other countries that haven't made it here yet, is there anything that anyone has seen?
No, I mean, there's some stuff preliminary, but obviously you got to get FDA approved here, right, before you bring it here. But I'm trying to think of anything that I've seen that's unique and different. Off the top of my head, quite frankly, I mean, a lot of stuff overseas has some great results, but once you bring it over here, sometimes it doesn't translate. So what we've seen, and obviously there's an extensive process to get FDA approval for those devices, because especially if you're looking to do it from a clinician standpoint, you can't just do any wearable. I mean, pretty much activity trackers, anything dealing with fitness, you can kind of say that's just a general device. But if you're really trying to do, like we deal with COPD, one of our main chronic conditions, a lot of devices that we talk to, they have to be FDA approval. There's companies like Cohero, Propeller, we work with oxygen concentrators, pulling all that data into our platform. They all FDA approval. So not off the top of my head, I can't think of anything outside this country that's unique and different.
So anything that you have seen similar to the story we just heard about implanting of blood glucose into the cat? Oh, or the human or the cat. Have you seen anything like that?
That's going to go really slowly.
I have a question back. Is that something that is in an experimental stage, or is that really deployed broadly?
I have a student in class that is diabetic, and I don't know where the monitor is on her body, but it is not, I mean, her phone buzzes her when her glucose changes. So, and during a presentation, it spiked. This is how I know about it. So I don't know exactly. I don't think it's an implant, but I think it's probably close to what you're talking about.
Yeah, I'm familiar with what they call continuous monitoring glucose, where they do, embed something in you and it knows what your glucose levels are without having to prick your finger. So I'm familiar with those, but when you talk about the cat, that's when I go off. I'm not familiar with that one, but I'm familiar with the continuous versus the prick version. But yeah, I think that's and that brings up a good point. I mean, some of the wearables, like you guys all heard about the pill, right? You swallow to kind of get track of you when you take your pill for medication compliance. So that's the next phase, right? Of ingestible wearables, and that's in your body. And and I think you probably can get a little bit more information, but obviously the approval process has got to be through the roof, right? Because now you're ingesting things into your body, and how does that affect your biology and all that? That's going to be interesting. Okay. Yeah, I mean, from what we saw is initially, not having that physical person, helping them, get it understood what this is checking, what's going on here. You sometimes have to physically kind of be with, because they're older patients, understand, this is what this is for. And then even a couple of times after that, walking them through that process, right? And so I think that's kind of what's, preventing the adoption. But you'll be, it is changing. When I started 4 years ago, this is definitely changing because people are becoming more savvy with this, and they're familiar with these, especially the Fitbit and the Apple Watches and things like that. But I think that's the key, right? Just having to walk them through this process, because it's a new behavior, right? And quite frankly, older patients, especially in the chronic condition space, Medicare population, they're the ones who, a little slow when it comes to, technology adoption. So I think you're right. You're spot on with that. But it's changing.
Yeah, I think, just continuing on that theme, you'll be surprised that sometimes it's access. Sometimes some seniors don't have transportation, so they might go back home, and even though they know that certain condition is getting worse, they may not have access to transportation for them to go to the place to seek the help. Or in some cases, I think there are activities of daily living, right, that you don't see getting performed. I think so. Those are kinds of things that exacerbate the situation. So it's not just about wearables. It's about, I think, totally understanding, I think, what's going on with them, right? And that's where you start seeing a lot of advancement happening in at home, right? While there are technologies to start seeing, I think, whether they are, I think, really performing those activities of daily living, whether there is consumption of the right food and things like that, and if there is an understanding of there are need for transportation as well, providing those services. In fact, it's proven that when you provide those services, they end up being cheaper than when the hospitalization happens. So recognizing all of those from a totality perspective, and that's where it's not just about the clinical piece, it's also about the consumer, the demographics, the socioeconomic conditions, what the community health is, what the access is. You really need to start getting a total picture from a data perspective and really manage an individual who is in that situation and make sure that they are being taken care of and continuous information is coming across as how are they doing. And that's the kind of things that I think is we have to continue to develop.
So our last question?
I agree. I think it's a combination. When you look at the population, especially the younger population, those with chronic conditions over there, I think you need to create those kinds of engaging capabilities which really allow by themselves. And today, the self-reported data is becoming a big part of the back-end analysis to say, okay, if I'm getting self-reported data, how do I use that data? But there are also, there's some advancement that has to take place in regulations and also public policy that, even today, you can't use some of that data without the doctor certifying that data to say, I agree that that data proves that there is certain condition that is going to happen. So this is nascent in its stages right now, but at the end of the day, individual and personal accountability, right, and responsibility has to come along with the public policy as well as what top-down approaches that whether the providers or whether the doctors themselves are providing. It's a combination of all of those that has to take place. I think that the general awareness of health and how much health is important, if you look at the last few years, I think there's a lot more recognition of that. So it is going to, I think it'll help, and we'll start seeing how the self-reported data starts making a difference in treatments of those individuals and managing health outcomes.
Well, I also think that you get to the motivation issue. If somebody's not motivated to exercise or eat well, they're just really not going to do it, right? And so how do you do that? And right, we've clearly not figured that out. And just having a gadget that you wear on your wrist or is in your phone is not going to change fundamental core behaviors. And I would argue that our society's not set up to motivate you to move, right? And it's increasingly becoming more and more digital, which increasingly incentivizes you to sit on your butt and get eye strain. And so I think that we're in a real conundrum, right? We're seeing a lot of problems in health, and we want people to be motivated, and we're creating these gadgets to hopefully incentivize people to be motivated, but yet our society is moving in the exact opposite direction in a more accelerated way, and I think it's a real problem.
Yeah. So he's been raising his hand the whole time. Should we, yeah. Just really quick.
One more quick question.
Yeah.
Yeah, I mean, so basically you're asking what do we think about the new partnership with Amazon, JP Morgan, and Berkshire Hathaway. So I'm excited about it. Now, I'm leery because Amazon has a lot of our money as it is. And so now they're getting into the healthcare business, and so, they truly will become the everything store. But as an innovator in the health space, I didn't really originate in this space. I was with the Cisco Systems, other companies who were innovative. This is definitely the slowest adoption rate by far, right, of any technology thing I worked with. So I think they will push the insurers to want to innovate even faster. I mean, the stuff that they're doing now is great and wonderful. I guarantee if Amazon comes with something tomorrow, you're going to see even faster innovation coming out of that, and that helps all of us and just raises all up. So I'm excited about it, what they can bring to the picture.
I am a little more skeptical. I think if any group can move the needle, it's Warren Buffett and whoever he chooses to be friends with, right? So, so I think that, and I do think that we need a fundamental cataclysmic shift to straighten this out. And this could be it if they can figure it out, but none of them are in the healthcare business. And I'm not sure that they really know what they're getting into, but I'm excited to watch it.
Great. Okay.
Our experience really is that I think integrated care delivery, integration is the key part, right? And those three words really mean that. It's integrated care delivery. There has to be a partnership across all the partners, players in the ecosystem. The faster the integration happens, any forces that drive that integration and demonstrate how to integrate and make sure there is openness and willingness of the data that is shared across, and that really will drive the improvement in health outcomes for the members and for the consumers. So that's the model that I think what we have seen, that I think the more you do integration and the integrated care delivery model holistically is really, I think, will lead to better outcomes for everybody in the value chain. So that's our experience, and anything that helps accelerate that is always welcome.
Okay. So thank you so much.